Welcome to the Pain Relief Path podcast, where I dive into the vast world of chronic pain with the occasional help from knowledgeable guests from diverse disciplines that impact your chronic pain. I am your host, Dr. Pan Zhang, physical therapist turned chronic pain coach. I'm here to educate, empower, and encourage you to find your path to a pain-free life. Thank you for listening. Enjoy. Good morning. It's morning here up on the mountain where I live, and welcome back to Pain Relief Path. Today, I have an awesome guest and friend on. Her name is Jessica, and she is a physical therapist in the Portland, Oregon area, and you work for Whole Body Health Physical Therapy, and we are fellows of pain science. I rehearsed that in my head, and it sounded so fun. I couldn't wait to say it out loud.
Fellows.
Yes. So we've known each other for a couple of years now, I think, right? And Jessica is one of the most deliberate, mindful people I know. I know you're going to laugh at that, but It's true. And on top of that, what we're going to be talking about today is mindfulness and mindfulness-based practices, and basically what it means, what it is, and how it applies to people with chronic pain. And honestly, even if you don't have chronic pain, this is a great episode for you to listen in on, because we're going to be talking about things that everybody can apply to their lives all the time. So Jessica, if you don't mind telling us a little bit more about yourself and how you kind of gone from your journey as a physical therapist and working and really almost specializing in mindfulness, if you will, and how that looked.
Yeah, absolutely. And also thanks, Pan. It's always fun to nerd out about pain with a fellow. And then this is also another one of my favorite topics to talk about, just because I've had so much benefit from it as well. A lot of my exposure was about 20 years ago when I was practicing yoga and teaching yoga, actually. And so it was always like, I'm doing my moving meditation. And so then it transformed. I joke that yoga was my gateway drug to meditation. So I'll get into that a little later though, maybe. So yeah, around that time I was doing yoga certification programs with Sarah Powers, who integrates a lot of mindfulness and insight. And I was doing yearly 10-day silent retreats through Spirit Rock Meditation Center in the Bay Area. And then I did an MBSR program, which is the well-known Mindfulness Based Stress Reduction program. It's 8 weeks long. And then, of course, during this time, I was really doing it for myself. I wasn't doing it for anybody else but myself. And then I realized how much it was important in my practice as a physical therapist. So I took a class that was called Compassion, Presence, and Resiliency for Healthcare Providers. That was with Mark Coleman. And then I also took a class with Tara Brock that was mindfulness and psychotherapy. And both of those really helped me hone my personal journey skills with both self-care as being a provider, and then also how to teach people better in the clinic.
Yeah, that's awesome. So before we get into the meat of everything, like you said, I'd love to hear about your journey to this place. Like, how did yoga transform into mindfulness and meditation?
Yeah, I started practicing yoga in 1998. It was more because it was, I don't know, everybody started doing it around that time. And I was like, oh, let's see what this is all about. I did a couple different types of yoga and really learned to hone my attention skills. And I really loved the way I felt during yoga. And I started to feel the benefits of yoga for my lifelong struggle with depression. So I'm okay talking about that as a thing that I've struggled with for a long time. And yoga was super helpful. What happened though was I was fine when I was moving. As soon as I would stop and I'd be alone with my mind though, it was not good. So it was probably like 2003 or 2004. I was noticing that I was having a lot of racing mind before bed. So I was just like I try to go to sleep and I'm just like, oh, I need to do that. I need to do this. I'm like ruminating, I'm predicting the future. And I really wanted to seek out another way to address that besides just therapy and medication. So I went to a few meditation workshops. I started reading Full Catastrophe Living by Jon Kabat-Zinn, which is sort of like the revolutionary book from a long time ago. And it's funny because during this time, I was like, well, I'm pretty sure this is going to help with my stress and the racing mind, but there's no way this is going to help with my depression. And of course, that's like such a depressed person's way of thinking, right? That it's not going to be helpful. But it was hard. So I remember the very first time I was in my house and I set the timer for 10 minutes. And I'm like, okay, I'm going to set this timer and I'm going to sit here quietly. I think I opened my eyes every 10 seconds thinking it was over. Mm-hmm. So it was hard. Mm-hmm. Yeah. So that's kind of how I started. And part of the challenge is what enticed me to do it more, right? Sort of that like, oh gosh, this was hard. How do I get better at this? So there was a little bit of that drive. So honestly, it took a little bit to actually see the benefits.
And I think, and that's going to be the same with anything that's worth doing, right? It's not going to be like you do it once and suddenly you're cured of anything. And I think, and we'll get into what mindfulness is in just a second, but to your points, I think a lot of people with chronic pain, especially, hear all the time, like, you should just meditate or practice mindfulness. And they're like, what? Like, that's not going to help me do anything. And it's not if you have no guidance or you're not really given appropriate expectations on what it's actually going to look like. Like, I think a lot of people with chronic pain just hear, oh, I need to practice mindfulness and my pain will go away. And that's not exactly how that works, right?
And it's so hard though. I mean, we live in a society where everybody wants instant gratification. We want quick results and we want them now. I mean, that's the definition of quick results, but you know what I mean?
Yeah, no, totally. And I think that is probably going to resonate with a ton of people, and especially people in pain, because you're miserable and you don't want to be in pain anymore. So, and you don't want to be miserable anymore. So you want it now, but unfortunately, if it's taking you a long time to get to where you are, it's going to take some time to get you out of that place as well. Absolutely. So what is mindfulness? Because mindfulness, like I said, you hear it everywhere. It's such a buzzword, and people are saying it from like, celebrities to like your next door neighbor's daughter who's like 5. What is it?
Yeah, I agree. It's like one of those buzzwords that sometimes you're just like, can we stop using that word? And not to get philosophical or curmudgeon, but sometimes I'm a little both. Our society can't see and value something that can't be monetized and marketed, right? And so when you have something like mindfulness that does have results, I mean, both in research and just, by people's experience, well, everybody's going to want to get on that train. And that's just what our society does. So sorry about the philosophical side note, but I honestly love hearing how much it's talked about. I love that it's being introduced in schools to very young children. I love that corporations are having employees do it. I love the accessibility now through apps and YouTube channels and streaming programs. I mean, it's almost overwhelming how many resources there are now. And so the definition, let's go back to Jon Kabat-Zinn, because I think that's the most well-known one. And mindfulness is really just awareness that arises through paying attention in a very particular way. And that's on purpose, in the present moment, and non-judgmentally. And this definition really outlines the core parts of how to be mindful, because it's a way of being. You're paying attention to the present moment in a non-judgmental way. That means we're not going into a story about what's happening, whether that's the story from the past, and we're not making predictions about the future. And it's also not about clearing your mind. That is just not what mindfulness is, because honestly, it's almost impossible.
Right.
So really, the two parts that I think are important to remember are attention and non-judgment.
Yes. And I feel like, I mean, I've practiced some of this myself, definitely not super regularly, but I feel like when I am in a state or a season where my brain's just like going and going, I'll be like, oh, I should probably do that thing that I tell people to do all the time, right? But it's true that just being present and paying attention to the right now is so difficult. I'm one of those people who think about when I sit down and I quiet down for 10 seconds, before I know it, I've mapped out the rest of my week. And that's like what I'm going to be doing, my goals for the rest of the week. And that defeats the purpose. But the non-judgmental part for me, and I'd love to hear your take on this, is when I catch myself doing that, instead of kicking myself and being like, oh, I just wasted like 2 minutes planning out my week, just coming back and just being like, that's okay. And let's come back to it.
Yeah. I mean, planning out your week in 2 minutes is actually pretty impressive. So I wouldn't take that skill away from you, but I like that you try not to put a flavor on it, right? You're not like, oh, that's a good thing or a bad thing. Wow, I was planning. And that's where mindfulness uses a lot of what's called naming or labeling, which is where you just note what's happening with very simple words to describe it. And so in that moment that you're thinking about your week, you're like, oh, there's planning. Okay, now let me just come back to what I'm doing now. That's mindfulness.
So how is mindfulness different from meditation? Because you hear both terms a lot. Is there a difference, or are they kind of the same thing?
You know, they're used interchangeably a lot. And I'm sure there's some academic who, you know, will have a lot to say about this, but just basically think about meditation as an activity. It's the time that you set aside and you are practicing something. And meditation is a larger umbrella for practicing those skills. So you can have mindfulness meditation, you can have breathing meditation, there's transcendental meditation, progressive relaxation, loving kindness. So there are a lot of different ways you can meditate. Whereas mindfulness is more of the quality of your attention and a mindset. It's how you're relating to the moment. So you can be mindful throughout the day. You can do mindful eating. You can do mindful teeth brushing. But it's when you set aside time that you are practicing and honing that skill, that's meditation. So that's kind of how I see the difference.
Gotcha. So yeah, the meditation is the actual practice, and each type of meditation, like you were saying, like the loving kindness, is that just like the way to kind of guide that session a little bit?
Yeah, I think that's a good way to think about it. Because when I sit down to meditate, sometimes I have a practice that I want to do. I'm like, I need to practice the skill of mindfulness of thoughts, right? So it's almost like mindfulness is the place to hone and refine your skills. So because you've set yourself aside, like you've put that energy and time into setting that aside to do it. And mindfulness, then you can pull that skill and apply it throughout the day.
Gotcha.
Yeah.
That's a great, I think that's a very good just definition of the two. And honestly, I've been using them interchangeably without really thinking about it. And I think that's definitely something that I can kind of go forward and be like, okay, I can be mindful today and then practice meditation like in a chunk of time.
Yeah, I think that's great. But it's also okay if you use them interchangeably. I mean, come on, it's okay.
Or non-judgmental, right?
Yeah, exactly. Non-judgmental. I love it.
So with meditation or mindfulness or both, what for the general public, what are the benefits? I know you've done a lot of research on it, and there's great research, like good quality research showing that it has great benefits. But what in general does it do for you?
So this is where it's interesting because if you look at the list of what people claim mindfulness can do, you're going to think, oh my gosh, what is this magical thing? And really, honestly, if it had been such a buzzword 20 years ago when I was looking into it, I probably would have been too rebellious to try something that is so mainstream and so, I don't know, pressured on everyone. Like, oh, you have to do this. And also there is a lot of research, but the research is also tricky because of how different the definitions are of mindfulness and meditation. So I'm just going to lay that out there. But I will say also that I try to be careful about thinking that every single person will benefit from one thing, right? And I think you get that as well in what you do, which is, everybody needs something different. And I think mindfulness is a great thing to try, and be okay if it doesn't work for you. I don't feel like we need to pressure anybody to think that it's the thing. But with that said, there is a lot of research suggesting it can help with stress, depression, anxiety, sleep, high blood pressure, and of course, pain. And besides all the research that's out there, you could also just ask anybody who practices and ask them what their experience is like, because I think that's pretty powerful too, is stepping outside of the research and just hearing what other people have experienced.
Yep. And I think one other note about research is that research is another thing that's tricky, is that are we measuring the right things in research? And are the things that mindfulness can help with, are they measurable things in the research setting, right?
Hard.
So it's that definitely makes it tricky. So if you are listening to this and you're very, very big on like, I will only do what the research says is good for me, and there's like, not like statistically significant improvements in the research articles, just keep that in the back of your mind too. But like anecdotal evidence and stories, and especially stories that you can relate to, I think are so, so important, because it really helps in like just, hey, it worked for that person. It's really going to bolster your confidence in this too.
Right. I totally agree with that.
Yeah. And I really like what you were saying earlier. It's not for everybody. And I agree with that completely. It's just like, you might have a friend who has chronic pain and the keto diet just took away their pain, just suddenly, right? Or you have that friend who tried mindfulness and all of a sudden they're like, just like a fairy floating in the clouds and they're fine, which is fantastic. And if that worked for them, that's great, but don't be too hard on yourself. If you're like, oh, that worked for them, it has to work for me. And if it doesn't, there's something wrong with me. And that, I hear that a lot. It's like, well, these things worked for these people. Why is it not working for me? There must be something so much deeper wrong with me because it's not working.
Yeah, that's such a scary place to end up too. But yeah, it's different for everybody. Sometimes it's more subtle too. And the trick with mindfulness is also that we, as much as possible, we need to practice it without expectations that something will change. So that sounds very crazy, very, very crazy. And especially for someone who has chronic pain, to say that you want to do something, but you don't want to be attached to the outcome, is kind of invalidating in a way, because, oh my gosh, of course we want your pain to change. Of course, like if you have pain, I've had pain, I wanted to change. When I started meditating and I wanted to change my depression, that was a motivating factor. But the real magic though happens when you can let go of that and you practice without the expectation that something will change.
It's almost like you're just practicing just for the sake of the practice itself.
That is true. And it is harder than it sounds.
Yeah, definitely. Especially, I mean, this is all harder than it sounds, by the way. Like practicing non-judgmentally, that alone is just a huge thing. And then just like we use the words like paying attention, and that's just, it sounds very simple, but truly to pay attention it takes so much effort, because we're not used to doing those kind of things on a day-to-day basis in our society anymore.
Oh yeah. Oh, we could go off on this for a long time about how our attention is getting taken off in all different directions.
Yes.
Phones.
Yes. I am guilty of that one for sure. 100%.
Oh yeah, me too.
So with chronic with the people with chronic pain, how I know a big part of this is not to be attached to that outcome, but how does mindfulness help somebody with chronic pain or somebody who's been dealing with chronic health issues even for a long period of time?
Yeah, yeah. It is that quality of attention that you were just talking about. Like, it's about the attention, and pain is really our nervous system's way of trying to get our attention for something, right? So it's hard to think that we're supposed to not pay attention to something that feels so incredibly intense. But it's changing the quality of the attention. So think about when you experience pain, there's a lot of emotional reactivity and stories around it and expectations. And, as with the work that you do, you find out that those stories and expectations and emotions that are wrapped around your experience are what drive the nervous system sensitivity up, right? That volume of your nervous system gets turned way up. So mindfulness just allows us to take a moment, see our experience as a sensation, maybe unpleasant, that's okay to label, but to try to get out of that stress pain feedback loop or that downward spiral that we can get into when we experience pain and suddenly we're outlining all the things that are going to happen afterwards. So because mindfulness is about this attention and judgment, non-judgment, think about how the quality of both of these can be used to decrease that reactivity. And even just, the scariness of having chronic pain, right?
Yep. That
And
fear.
so it's kind of acceptance. And again, talking to someone with chronic pain and talking about acceptance can also feel invalidating. So we're just really talking about being present with what's happening in this moment. And what's happening in any particular moment is not necessarily what's going to be happening forever. And so if we can step back and see clearly what's happening in the moment by practicing mindfulness, we're allowing just the sensations to be there. We're not preventing them. We're just watching them. And then you can see when you just watch that all of it is a changing landscape. And that's kind of more helpful than it sounds, because allowing that observance of how things change and are not forever means that that fear and that worry can get turned down. And then overall, our nervous system can calm.
Yeah, I love that. And if you're dealing with a flare up right now, or you can remember back to the last time you've had a flare up, that fear, that first thing you think of is, oh crap, how long is this going to last? Is this going to be the flare up that lasts forever? And that fear of just not knowing, but like you saying, the acceptance of like things are going to change and things are not going to be like what you're experiencing right now in this minute can be very different than what you're going to experience in 2 minutes or 5 minutes or like a day even.
Right. But if our nervous system is trying to protect us, we have what's called a negativity bias, right? Our brains are just wired to be a little bit more on alert for the things that might be threatening. So when we experience that flare up and you're just like, oh, this again, I thought I was getting better, right? And now what am I going to do about work and my family? It's scary. And I also know, again, that like to say like, oh, have you tried breathing? Have you tried mindfulness? Can just feel so infuriating to people struggling with chronic pain. And we're not saying that any of these things are the thing that are going to turn that nervous system back down to zero, right? And calm you immediately. It's part of helping the nervous system be able to see a little bit more clearly in the moment and not get caught up in that downward spiral.
Yep, exactly. And it's, some days you're going to need to do this a little bit more. And some days you might not have to worry about this at all. Or even really thinking about like, oh, I really should be mindful today. Like, it's like I said, for me, it's not a daily practice, which would probably benefit me quite a bit, but it isn't a daily practice completely. I'll be completely, transparent about that. But I know on certain times, or certain seasons and certain weeks, I need to pay attention to this more often. And I've figured out those times for me, you know?
That's great.
Yeah.
Yeah. And so there is an art of that. There's that art of consistency. There's benefit to that. And there's the art of being able to take that moment, because that sounds like you're being mindful. You're like, oh, my nervous system needs this now. And so you're able to like recognize that and use that as a tool. And that's okay.
Yeah. I thank you. It's not, yeah, like that. It's like, oh, I'm being mindful without even knowing it. That's great.
Yeah.
So some of the common challenges, we've kind of talked about this a little bit, especially with people dealing with chronic pain, is that, you know, I hear it all the time. It's like, I can't do this. I just get distracted too easily. The voices in my head are too loud. Like, or I have things like, you know, other diagnoses such as like ADD or ADHD, things like that. What would be your answer to people who are just like, I don't want to say it in this is not meant to be in a negative way, but kind of just like, I don't think I can do that, so I'm not even going to try to do it.
Yeah. I think you're recognizing, and I think that's normal to recognize how intense it can be to be alone with your own mind, and to recognize that ahead of the fact is limiting though, right? And that's what you're saying. Like people are seeing that, recognizing the complexity of the human mind and how much is going on there, but then they're limiting themselves. So the antidote to that is curiosity, right? Like maybe just try, see what happens, right? Just, you know, it is going to be overwhelming, especially if you do have ADD or ADHD, you know, or depression or anxiety, or trauma. Like all of these things make it a little bit harder. And I think the antidote again is just being curious, making just a little space to notice that yes, it's hard, and yes, you get distracted. But the key here is that each time that you try to make space for the moment and you notice that your mind is going off a million miles a minute or whatever, that is a mindful moment. You just practice mindfulness. You're like, oh, wow, look at that. That is intense, mile a minute mind going. And you come back to the present moment, and then you're non-judgmental about it, right? And there you go. You just practice mindfulness. Yep. So I have this analogy, and I wish that I could remember who did this, but you know, for so long I was practicing mindfulness just for myself. So everything I took in, I just sort of took in without thinking about like referencing and, you know, attributing things to people. There's an analogy that, let's say you're sitting on the bank of a river. Okay. And in the river are thoughts and emotions and worry and the past. And as you're sitting on the bank of the river, you can watch each of those things go by and you just name them. Like there's planning, there's worrying, there's mind racing, but you are not dipping your toes in far enough that you are going to get pulled into the river and pulled downstream, hopefully. But it happens when you first start practicing mindfulness. And even now it happens to me. You're going to sit, you're going to be labeling, and then some unknown amount of time is going to pass and you're going to be like, how did I even get here? Because your mind had just taken you down the river on this journey. And then that moment that you realize that you've been taken down into the river is when you come back to the moment and you have practiced mindfulness. And that is it.
I love that. And I think a lot of people's self-limiting practice is this obsession we have with perfectionism too. It's like, well, if I try this, I have to be able to do it like immediately, or else it's just not worth it. And I can say that because that's how I feel. Like that's where it's coming from for me too. And I love that, like, even when you feel like you're doing it wrong, that moment you feel like you're doing it wrong is that moment of mindfulness. I've never that way. That's pretty great. Very
Yeah.
insightful.
And I'm a recovering perfectionist, so I know that feeling well, and I still struggle with that. So, and again, it's, that it's not wrong.
Mhm.
And that, yeah, like you said, you're just practicing for the sake of practicing.
Yep. Yeah, that's great. So I would love to hear what your mindfulness practice looks like. Like what do you do? Like, are you doing this every day? Are you doing this like in seasons, or what does this look like for you?
Yeah, I've been off season. So I actually work mindfulness in throughout my day, and it's an important part of how I manage and take care of my mental and physical health.
Mhm.
So if I notice that I am uh, kind of ruminating on something, like something I said on a podcast, so hopefully that doesn't happen with this, but anything that I said and I'm ruminating, or I'm kind of like going to the future, like, oh, I'm really worried about, what I'm going to do with this person, whatever. I try to recognize that I'm kind of going off, and I just come back. And the way that I do that most throughout the day is by grounding myself in my physical body or my physical experience. So that's like, I'll just take that moment and feel my feet on the ground, or I'll just go right to feeling the movement of my breath in my belly.
Mhm.
So I do that a lot during the day. I even bike commute. So there are times that I'm bike commuting and I start thinking about something and I start worrying, and I'm like, again, just like going off, and I'll just take that moment and feel that like breeze on my skin as I'm moving through space. So that's kind of nice. And then I do practice daily. And I will say that even sometimes it's 5 minutes. And you know what? Those days that I think that I'm too busy to do it, and yet I set my timer for 5 minutes, whether I'm standing, sitting, lying down, at work, outside, indoors, those are the most powerful days, because those are the days that I think that I'm not going to have enough time. And I make 5 minutes and I just stop doing whatever I'm doing and get to refine that. And I'm taking that time for myself. Um, so yeah, some days it's 5 minutes, some days it's an hour, but I have found for me, it's best to have that really consistent practice.
Yeah. And I think from what you're saying, I think people in their mind's eye, when they think sitting down to practice to meditate, you have to have quiet. You have to have like that special meditation cushion to sit on. And you have to be in like this very nice Zen spot in your house or something. But that's not necessarily true, right?
Oh, not at all. And I even joked when I first started meditating that my goal would be to meditate on a construction site. And some of us might live in areas that feel like construction sites. And it does make it a little harder to practice when there's a lot going on. But for the most part, yeah, you don't have to sit or do anything weird with your hands. Just let yourself be comfortable. Notice what's happening in your body, notice what sounds are happening in your environment, right? Because sometimes you're like, okay, neighbor's hammering, right? Sometimes you want to go into a story about why the neighbor's hammering and how angry you are, but that could just be a mindful practice too. Okay, hammering.
Yep. Yep. Fantastic. I love that. So with that, that's how you incorporate it into your own life and your own practice. How do you incorporate it into your professional practice? Like, how are you taking people that come to see you with chronic pain or just even sprained ankles sometimes, right? How does that look like for a patient?
Yeah, I really like to start the conversation with what they've been exposed to before, because like you started with in this interview, mindfulness is a buzzword and lots of people have said that they practice mindfulness. And so I like to find out what people have tried, what has felt good to them, what has felt hard. But if I were to start with somebody right from the beginning, there are a few things that I like to do. The first one is called pulsing. And what you do is you just find your pulse on your wrist. So inner part of your thumb, just go down about an inch and just relax and just feel your pulse. That's it. So this is what we start with sometimes when we just really have to start having people feel comfortable attending to the moment. Because sometimes if you have someone just sit and say, okay, now just be mindful, like there's just like so much. So grounding in the physical body can be a really great way to just start honing that attention skill.
Mm-hmm.
So once that feels comfortable for someone to bring attention to themselves, then I usually like to go to mindful breathing, which is just you find where you feel the breath most prominent for you. So some people feel like they can feel the air going in and out of their nose. Some people like to feel that their belly expands on the inhale and relaxes on the exhale. You just pick one of those spots and you just let your attention rest there. Even just like inhale, belly rises, exhale, belly relaxes. And during that time, of course, you're going to like, your brain's going to start going, hey, what are you having for lunch? Hey, you need to get groceries. Hey, what'd you say that thing for on that podcast? And during that time, you're going to say, oh, look at that. I'm thinking. And then you're just going to say, okay, thinking, coming back to my breath. And then you're going to take that breath in and breath out. So those are the two that I really like to start with. If I have somebody who's in a lot of pain or has had a lot of chronic pain, because pain is a way, as we talked about, of getting your attention, what happens is for a lot of people, chronic pain becomes that part of their body is the only thing they can attend to, right? That's it. So I actually start doing a physical practice where I have them pick a non-painful part of their body. So let's say, okay, some people will be like, my left pinky finger is the only part of my body that does not hurt right now. And I'll say, okay, let's bring all of our awareness to the right pinky finger as I'm holding up my left pinky finger. And so that's like, okay, do you feel the air on your skin? Can you feel the temperature? Maybe there's like buzzing or pulsing in your pinky finger. So something that's simple where you're just learning to build attentional skills so that you are not just attending to the painful parts of your body.
That's fantastic. I'm like following along as you're doing these, and I'm just like, oh, okay. And then I remembered I have to continue with the interview questions. So here we are. So that's great. So how do people usually respond to some of those things? Are they pretty positive? Have you ever had like negative responses?
Mm-hmm. Yeah, I would say most people respond positively. And when people respond negatively, it really tells us a lot about the state of the nervous system in that moment. Some people tend to dissociate more, especially if there's been a trauma experience. And so bringing attention and just allowing to see things change in the physical body can be very scary. So there have been a few times working with people with trauma that's just too intense. And again, sometimes we just end up doing pulsing. And so, yeah, that's another thing is, obviously there must be a disclaimer on your podcast, Pan, that we are not offering medical advice. We are just fellows talking about pain. So if you do start a meditation program and you're really struggling with being with any sensations, please seek your medical provider for help.
Yes. Fantastic. So if somebody is really wanting to start this and they're listening to this and they're like, this is something that I feel like I can do, how would you advise them to start? Like just 2 or 3 things that they can easily start incorporating throughout their day.
Yeah, I would try to create that habit of consistency and also just get used to setting aside the time for yourself. I remember that first time that I set that timer that was so hard. And I don't think I even got through the 10 minutes, by the way. I was kind of embarrassed. Is that weird? I was like by myself in my room and I was embarrassed to actually sit down with a timer, set it and close my eyes for myself. I was like, silly, this is weird. What am I doing? So I would say if that happens to you, that can be normal. But if you could just set aside 2 to 3 minutes, so that could be in your car before you go to work, just set your phone timer, put your phone down, and just start learning to make time where you are attending to yourself. Because sometimes that's harder to do than it sounds as well. And you could just start and play. Like, what's that like to listen to your breath for 2 to 3 minutes?
Mhm.
And if you get disappointed, that's okay. You're just going to try again the next day.
Mhm.
Yeah.
Yep. Like you've said before, when you acknowledge that feeling of disappointment or embarrassment, then you're being mindful. Yay.
Yay. I don't know what that was all about.
That sounds like ego, right? That sounds like that perfectionism rearing its ugly head, like you weren't able to do this, so this might not be for you, but
Yeah.
that's just not how it is.
That's a really good point. That's a really good point. I was actually listening to a Huberman podcast this morning. And he was saying that he made a joke that it was like all of his interviews were just a decoy for actually like psychologically evaluating the person being interviewed.
So my interviews are a decoy for me to just learn more about how to improve my own life. So
yeah. I mean, don't we all, like, everything we learn is kind of for ourselves and for others, right?
right, exactly. So kind of wrapping this up,
Mhm.
I think those are fantastic things. Just so if you're listening and you're like, I want to start, I think I can do this. The easiest thing is just 2 or 3 minutes,
Mhm.
and that's it. And it can be, sitting in your car before you go into your house for the day, or sitting in your car before you're going into work for just a couple of minutes,
Yeah,
before, life hits you, basically.
absolutely. Yeah. Because once we get started, we start checking our email.
Mhm.
The
Yep.
day is gone.
I agree. I will say, just definitely, when you were saying set a timer on your phone, and do not get distracted. Just set that timer, because there's been so many times when I go to do something on my phone, and like half an hour later, I'm like, what am I here for? I came here to do something, and I am 30 minutes into watching TikToks. What just happened?
That
Yeah.
happened when I went to sit to meditate. I went to go set the timer on my phone and I ended up being on Instagram for like 10 minutes. So
Yes. Yes.
happens
So
to
it
the
happens
best of
to
us.
it happens to everyone. Yes.
Yeah.
Yeah. And especially, I mean, it happens to you. You've been practicing for how many years now?
Almost 20.
Yeah. Yeah. So it's just like you said, it's a practice. You never perfect it. And it's just something that it's a part of your life.
Yeah, absolutely.
Yeah. So, kind of wrapping this up, this has been amazing. And like I said before, this is more of like okay, what am I going to do to implement into my life? But are there any nuggets of wisdom or anything that you really like to leave the audience with, before we wrap up?
Yeah, something I've been thinking a lot about lately is just how everybody's nervous system needs something different.
Mhm.
And the longer I practice physical therapy, and the more patients that I've seen with persisting pain, the more that I've realized that our job is pretty amazing, Pan. Because we're not just focusing on the mind, or we're not just focusing on someone's ankle or their body. Like, we really are taking in so much of the person's being and experience, and trying to find their unique combination of things to both calm their nervous system, right? Because we know that people with persisting pain sometimes have that volume turned way up, but we're also trying to find ways that we're just trying to nudge them into a little bit of like a little stress, right? Controlled, so that their nervous system can also learn to be more resilient to stresses.
Mhm.
And it's such a fascinating thing that we get to do, because we get to do physical and mental and emotional and spiritual and social, all of those realms. We're so
Yeah.
lucky.
Yes, 100%. And I love what you were saying about there's so much focus in decreasing the volume of our nervous system, but our nervous system is there for a reason. And we kind of touched on this a little bit earlier. It's there to tell you when there is danger or things that you need to pay attention to. And you don't want to turn that all the way off, because that's not good for you either. So training yourself to turn that volume up and then being able to turn it down, and then turning it up and then being able to turn it down is so, so key to make sure that, you know, you're being able to function and enjoy life and incorporate yourself into everything around you.
Yeah, absolutely. So thank you for what you do, Pan.
Oh, thank you. Pats on backs for everybody. It's like a circle. But anyway, so thank you so much, Jessica, for joining me today. I love this conversation. This was fantastic. And if people want to reach out to you, if they've got questions, if they are in the Portland area and want to come see you, how can they get in contact?
Yeah, so you can find me at the Whole Body Health PT website, and contact me through there. Or I can give you my email address, which is the longest email address in the history of emails, which is,
go ahead.
Yeah, it's JessicaMcConahay at wholebodyhealthpt.com. So
it's not that bad. And, you know, it's easy to remember. And I will also link it in the show notes and in the description below. So
okay, that's going to be so much easier. Copy and paste is like a dream come true.
Yes, especially when they're like hyperlinks and you can just click on it and it takes you to where you want to go.
Yeah, that's good too.
Yes. So, okay. So if you guys have any questions, feel free to reach out to Jessica. She is fantastic and amazing and non-judgmental, as you've seen. And then if you have any questions for me, feel free to reach out, hit up Pain Relief Path on my Instagram, and feel free to send me an email too at pan@painreliefpath.com. And yeah, happy mindfulness. I hope to hear, you know, how everybody progresses and starts. If you haven't started yet, I'd love to hear people's experiences with this.
Yeah, I'd love to hear that too.
Yeah, I'll forward that on to you.
Yeah, excellent.
Okay, cool. All right, have a great day.
You too.